Hello, I'm Jill Dietrich Mellon.
And I'm Dr. Susan Raffaelli.
VA Northeast Ohio Healthcare System is one of the largest and most complex VA networks in the country. We're a dedicated, highly experienced team of more than 6,300 work alongside academic and community partners to provide exceptional healthcare services and support for more than 140,000 veterans and their families.
The extraordinary achievements and advances this past year are a constant reminder that our dedicated healthcare professionals have consistently upheld the highest standards of veteran patient care and medical excellence.
For the past 3 years, the VA has focused on improving and enhancing 6 key areas of high priority, and our entire team has made a commitment to each of these 6 priorities: hiring faster and more competitively, connecting veterans to the soonest and best care, serving veterans with military environmental exposures, accelerating VA's journey to a high reliability organization, supporting veterans' whole health, their caregivers and survivors, and preventing veteran suicide. With this focus, once again, VA Northeast Ohio also earned the CMS Medicare and Medicaid Services 5-star rating in overall hospital quality. Veteran trust in the care they receive has risen to 94.4% here in Cleveland.
In 2024, we're proud to have served nearly 145,000 patients, including almost 12,000 women veterans, at our 17 locations across Northeast Ohio, from Sandusky to Willoughby to East Liverpool. Our staff conducted nearly 1.7 million outpatient clinic visits, and the Lewis Stokes VA Medical Center had more than 7,500 inpatient admissions. The PACT Act continued to be a major emphasis of communication and care in 2024. In alignment with PACT Act priorities, we completed more than 3,300 toxic exposure screening exams for veterans in the past year. To raise awareness, we began our first paid advertising to Northeast Ohio veterans in 2024, conducted a dozen veteran telephone town halls, held our first summer Vet Fest, and took part in more than 50 outreach events in the community, resulting in direct contact with nearly 2,200 veterans. We will continue to work hard to increase awareness among veterans, their families and friends, encouraging all to get the care they have earned from their service.
Veteran suicide has been a key priority for many years, and our dedicated work on this difficult issue is making an impact. Our suicide prevention program responded to more than 2,000 referrals from the Veteran Crisis Line in the past year. Currently, that program is coordinating the care for 215 high-risk veterans on average at any given time. Our Healthcare for Homeless Veterans program have assisted our local veterans with nearly 1,300 supportive housing vouchers to place veterans into low-cost housing and are using grant and per diem funds to fill 226 beds across 8 Northeast Ohio counties. During 2024, we helped to house 629 veterans, exceeding our goal by 34%. The Homeless Patient Aligned Care Team received and activated a special mobile exam vehicle in March, enabling them to visit homeless veterans and provide them with health assessments, preventative care, mental health services, and referrals to other VA homeless programs and resources.
In addition to our clinical care and numerous veteran support programs, we continue to be on the forefront of collaborative research and development initiatives. Our 2 nationally renowned research centers within the Lewis Stokes Cleveland VA Medical Center continue to make bold strides improving the lives of veterans. The Functional Electrical Stimulation and Advanced Platform Technology Centers are changing the future for veterans who suffer from limb loss, sensory and motor issues, and related loss of nervous system function. The APT Center performs research and development of prosthetic and orthotic devices, health monitoring and maintenance, and bioelectronic nervous system interfaces. Our FES Center studies the use of electrical currents to rehabilitate the nervous system and produce treatment for veterans that foster independence and improve quality of life.
Continuing our priority of putting the needs of veterans first, we've fostered valuable partnerships with multiple veteran service organizations and advocacy groups within the region. This proactive approach to community outreach gives our staff and veterans unique opportunities to participate in events such as emergency preparedness drills, adaptive athletic events, military branch celebrations and remembrance days, and holiday gift and meal handouts.
We are not standing still. We are working hard to improve the services offered to our veterans at the Primary Medical Center in Cleveland and through efforts to bring care to our veterans closer to the communities they live in. During 2024, we made several deliberate expansions to address care enhancement. The early phase of a major emergency department expansion was completed and activated. We brought mammography services to the Canton Clinic location and added the dermatology specialty to our Youngstown Clinic. Our Akron Clinic saw a major remodeling to incorporate satellite cancer infusion services under VA's National Close to Me initiative, allowing services for some 750 patients each year to be served while avoiding a long drive to the Lewis Stokes Cleveland VA Medical Center. Additionally, we broke ground on the Kenton Fusion and Imaging Center, which is scheduled to open in late 2025, slated to bring numerous diagnostic imaging and infusion services to nearly 50,000 patients who live more than 60 minutes away from the primary medical center.
Our care for Northeast Ohio veterans is grounded in our VA core values: integrity, commitment, advocacy, respect, and excellence. Taken together, these core values exemplify our standard of care at VA Northeast Ohio healthcare system and spawn continual improvement and innovation in approaching our mission of veteran care. We thank our patients, veterans' families and friends, and our community partners for your continued trust, and most importantly, your continued advocacy and support for those who've served and sacrificed so much in defense of our nation.